That's right. I was just explaining to somebody that I always consider Alfreda the younger sister of Marietta. There must be some reason the names are alike. But thanks for that introduction, Maria. I am a volunteer Vincentian from just up the road, and I've been a Vincentian for about 6 years. Started out as the spiritual advisor for our conference, and then moved into this role in what I was hoping was social justice, and it turns out it's really a lot more than that. So that's really what I do. How many folks are Vincentians in the room? X. So I'll try not to use too much jargon for those of you who aren't here, or aren't Vincentians. But I will tell you that that I just spent this past weekend in Indianapolis with something that I had never heard of before a couple of months ago, the Vincentian Family Gathering. That's a meeting that happens every couple of years of the Vincentian priests, all of the different orders of sisters that are based on the work of St. Vincent de Paul, as well as lay volunteers. And the really good news is there were a lot of kids. I didn't even realize that we have, how many have heard of the Jesuit Volunteer Corps? It's a group that where kids get out of college, they don't know what they want to do, and instead of, like me, move back home with their parents, decide that they're going to go on some adventure helping those in need. I didn't know we have that in this society. No, we do. We have it in about 5 cities. And if John Barry were here, I'd put him on the spot and say, we're going to get one here in Atlanta. Because it's really a cool thing. So anyway, I was there, and what we're talking about is how can we do more things to try to, what the society is calling, implement systemic change. Systemic change, the way the society has defined it, means how can we involve more of those in need in crafting the solutions to their lives. And I'll give you a quick example of how I did it inadvertently, just in a one-off basis, not with the community. One of the things we first started doing when we took over, when we started with Voice of the Poor, was we realized that there's a big problem with predatory lending in Georgia. Payday lending, title loans, quick, rapid refunds, lots of things where you pay huge interest rates to be able to get money fast. And of course, I, with my middle-class values, say that is so wrong. Why would anybody get involved in that? It's crazy. And so we thought that the solution was, let's just get more people banked. And so I spent 1.5 years working with an organization called Bank On, as it was getting started in Atlanta, and their job is to try to get more people banked. Well, I just happened to be on a home visit, and I asked you do this advocacy work for a while, and the list of questions that you ask changes. I hope after tonight, some of the list of questions that you ask when you're on home visits will change. Because asking people where do they get health care now is going to be a very, very important question. But I asked things like, who did your taxes last year? Because if it was a for-profit tax preparation service, then you probably spent $150, $125. You're asking us for $60 for your light bill. Let's see if we can find some of the free tax preparation services that there are around our geography. So and then I asked, where do you bank? Do you have a relationship with a bank? And a woman said, I don't. I use prepaid cards. And of course, then again, my middle class hat just flew up and said, what? There's so many fees. How could you do that? She said, I tried banking. I had a bank account for a long time, and I was bad at it. I never balanced my checkbook. I was one of those people that said if there's checks left, I must have money. And I was getting crushed with NSF charges. So I thought, well, I guess I could try to lecture her, or I could say, she's found a solution that works for her. She said, when I load the card, I know how much it costs. When I have to make a transaction, I know how much it costs. And when it's out of money, I get a little embarrassed when the lady at Walmart says, you don't have any money left on your card, but that's a lot better than $30 that I had to pay every time I was overdrawn. And that's when I realized that solutions that we have for those in need aren't always the solutions that they need. Now, sometimes there's a lack of vision. They don't necessarily have, in many cases, role models like we have. So sometimes you have to help craft some of that vision. But the Systemic Change Initiative is trying to find more ways to get people engaged in their own solutions. And I was very surprised to go all the way to Indianapolis to meet a nun from Macon, Georgia, who has a systemic change project there called Daybreak that I had heard a little bit about, but I didn't know much about it. I didn't know enough about it. And now I have to go visit it. It's a homeless shelter. It's a homeless daycare. It's not a shelter. It's a place where people can come during the day to take showers, to pick up mail, to get IDs if they need it. And it's a pretty cool place. So those are the kinds of things that we've been talking about. But I'm here to talk about Medicaid expansion. And back up my computer. Let me begin.
Did you say Medicare expansion?
Medicaid. I'm sorry, Medicaid. Medicaid expansion. Thank you. I'll start by saying I'm not here to defend the Affordable Care Act. I'm not here to tell you that the website's going to get fixed any minute now. I'm not here to defend a president who I think has done a really poor job of explaining this law so that people understand it. I'm also not an expert on the details of Medicaid. I am familiar with the issues that are engaged with expanding Medicaid. So that's really about what I'm prepared to talk about today. There's a lot of technical points to this, and I don't go into that much technical detail because there's experts that will write articles on it, and they don't agree. It is very, very, very difficult to figure out what is the truth when you're coming to statistics and facts around this issue. What I usually do is I look at the liberal economist, I look at the conservative economist, and then divide them in half. I do an average. Because it's different, they have different ways of looking at it. Everybody that's giving you information has a vested interest in the outcome. Not necessarily a financial interest, but it's very difficult to get real facts on some of on this issue. So we'll talk a little bit about it. If you have questions that I can't, no. When you have questions that I can't answer, we'll try to capture those, and I'll find some ways to get them answered. We do have a lot of resources that are working on this with us. And I'll find the answer and I'll send it out to Bev and she can get it out to all of you. I'll let you know that the reason that we, as Vincentians, got engaged in this is because, as you'll see, this issue touches the people that we serve. And so whenever we have an issue, we, the Voice of the Poor Committee, have an issue that we think is of concern to Vincentians, and the way we figure that out at first is from you all. You tell us what we should be working on. When we get an issue, we take it to our board, and we say, here are the facts. And I'll tell you, I was a little concerned when I took it to our board that it might cause a little dissension. One of the reasons that people tell me they don't want to start a Voice of the Poor Committee in their parish is because they're afraid it will lead to politics, and politics leads to fighting. Well, you run that risk. But the way I try to approach it, if you pick the issue that is truly at the heart of what we see in our home visits, there's going to be less controversy in that. We don't pick every issue that comes along. We have criteria that says, is there anything we can do about it? Is it close to the heart of Vincentians? Is it consistent with Catholic teaching? Is it something that we could win? And will it motivate Vincentians? And so that's our criteria for picking issues. And this is one that met our criteria, and our board approved it right away. So there wasn't nearly the controversy that I was anticipating. But I want to start with some information here. Some of you may have seen this.
Happened before. The last one was in 1996, but the debate on this one is particularly heated because people have such strong opinions about Obamacare. Interestingly, the polls show that most Americans say they don't like Obamacare, but they love what's in it when it all gets broken down. It's like the opposite of a McNugget. So, it's interesting. And when there are complicated issues to study, most people just side with whoever they usually side with. So I decided to conduct an experiment today. We sent a camera crew out on the Hollywood boulevards to ask people which they thought was better, the Affordable Care Act or Obamacare. Now, as you may know, Obamacare is just a nickname for the Affordable Care Act. They're the same thing. But lo and behold, we found people who did not know that, and that didn't stop them from weighing in on it.
We're talking about health care today, and which plan do you support? Obamacare or the Affordable Care Act?
The Affordable Care Act.
And what is it about Obamacare that you do not like?
I just think that there's a lot of holes in it, and it needs to be revamped. I think it
And you think
hasn't been thought out.
You think the Affordable Care Act is a better plan than Obamacare?
Better, but I'm not happy with that either.
What do you agree with, Obamacare or the Affordable Care Act?
I'm more sort of towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
So the Affordable Health Care Act is still a better option than
Yes.
Obamacare?
Yes.
And why do you not agree with the Affordable Care Act?
Well, I think it's not really available for all.
So the Affordable Care Act is more affordable than Obamacare?
Just the name says it all.
Right.
I think it's nice that everyone can afford it, and everyone should be able to afford it, but to force people to pay something and then doctors to make something, limiting their ability to do their job, that's kind of anti-American.
Right. So Obamacare is un-American?
I think it's kind of un-American to force people. What if they can't afford it? What if they want more
And the
coverage?
Affordable Care Act is American.
I think it's more American because it allows people to make their own choices on what they want and who they want to work with.
Do you agree with the Affordable Care Act or Obamacare?
The affordable.
And why do you prefer the Affordable Care Act over Obamacare?
I just don't agree with the whole Obamacare policy thing that's going on. I just don't agree with it.
And do you believe that an informed citizenry is essential to a democracy?
Yes,
So you disagree with Obamacare?
Yes, I do.
Do you think insurance companies should be able to exclude people with pre-existing conditions?
No.
Do you agree that young people should be able to stay on their parents' plans until they're 26?
They should be able to, yes.
Do you agree that companies with 50 or more employees should provide health care?
I do.
And so by that logic, you would be for the Affordable Care Act?
Yes.
What plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
And why do you support that over Obamacare?
Do not like Obamacare. I don't like anything that has to be forced for everybody to buy. This is not good.
Do you think Obamacare is socialist?
Yes, I do.
Do you think the Affordable Care Act is socialist?
No.
Obamacare will eventually lead to gun prohibition.
Yes.
Do you know that Obamacare and the Affordable Care Act are the same thing?
No, they're not. She made me look stupid. Okay, you did good.
You have a home here with me.
Good news is we're going to talk about both tonight. Now, I'm really not, I don't love those situations where you humiliate people to get your point across. But that was pretty easy. So, it is true, isn't it? That it's not so much that people are idiots. The truth is this is a complicated issue. that has been just vilified so well. I mean, President Obama eventually said, I'm not going to resist the Obamacare label anymore. I kind of like it. It's a law named after me. Well, by that time, Obamacare was just, it was a dirty word in many schools. But don't ever underestimate the power of marketing. Oh, the Affordable Care Act sounds more affordable, doesn't it? Why are we doing anything about healthcare in the first place? Well, if you've been working any of those years, or if you've seen a doctor any of those years, you know that the cost of healthcare has been spiraling out of control. I spent some time in human resources, working for the McGraw-Hill companies, and I was constantly incredulous. 20 to 25 to 30% increases every year. And when I go to my doctor, I'd say, are you getting that? No. I couldn't find where the money was going. I still don't know where the money was going. But how many have had their health care plans change so that you've had to make more contributions over the last 10 years? How many times have you had to switch doctors because the plans changed and you had to find a new way to get service? This isn't new. I mean, we've been talking about reforming healthcare for a number of years. Most people felt like something had to be done. And when you combine the amount of money that was being spent on healthcare with the number of people that were still uninsured, it was a pretty scary thing. This is by work status, by family income, and by age. And by the way, I can send this to people if you want it. I'll probably just send it to you, Bev, and you can send it on. It's estimated that there are almost 48 million people in the United States that are without health insurance. Georgia, I believe, is 5th in the United States in uninsured. Now, why does that matter?
We all pay for it.
We're all paying for it at the end of the day.
Where?
Emergency rooms.
Our premium?
Emergency rooms.
Emergency
An
rooms,
emergency
we gotta
room.
pay for
Emergency
it.
room.
There's even some hidden costs. The United States is number one in industrialized world in infant mortality. We lead the world in the number of kids that die in the first year of their life. In Georgia, I think we're 8th in the United States. Now, there's, of course, lots of things that go into play in why a kid doesn't live till their first birthday. And when you look at the differences between wealthy zip codes and poor zip codes in Georgia, if you don't cry, then you may need to check your faith. The differences are staggering. Now, we all know that there's issues in low-income homes that we don't necessarily have in well-to-do homes. But some of that has to be access to affordable health care. And if we can have better access to affordable health care and have more kids live in their first year of life, then to me it's worth it. Quick history lesson for those of you that like history. For those that don't, well, tough, I've got the microphone. So. Medicaid and Medicare came around in '65. They were very, very controversial. They had a lot of people that didn't agree with it. The individual mandates that are as part of the Affordable Care Act now were first proposed by the Heritage Foundation in 1989, which is a conservative think tank. It makes sense to most of us to say, if you want to get more people insured, get more people insured. So one of the problems that the Affordable Care Act is trying to solve, the reason that kids are now insured on their parents' policy, is because kids have a tendency to be healthy. Well, to compensate for the people that are unhealthy that you're now adding to insurance rules, you got to somehow get healthy people also insured. Just driving over tonight, NPR did a story on there's some places where kids are getting their health care for $50 a year under some of these exchanges because they're healthy. So to me, it makes sense to try to get more people insured. Probably most of us are familiar with President Clinton's attempt for health care reform. That didn't work. And as governor, Mitt Romney created a plan that the Affordable Care Act is modeled after, that still works pretty well in Massachusetts from everything you read. And that was, as I said, the model for the Affordable Care Act. Some of the things that are factual about the Affordable Care Act is that kids can stay on their parents' plan, prohibits pre-existing condition denying. The government is managing a marketplace for people who don't have insurance through their work. It doesn't introduce insurance mandates for individuals and businesses. And this is a big component that we'll come back to. A lot of it is paid, and this was all new news to me. If you've ever been in hospital work, you're familiar with it. But hospitals get credit from Medicaid for indigent care, for uninsured care. And that's going away because under the formula, there should be no more uninsured people. We're going to get caught in that trap because part of that is the last part. It's contingent on expanding Medicaid. Many of you will remember this law was challenged in court. It went immediately to the Supreme Court. Anytime you sue the president and you have any standing, it starts at the Supreme Court, where most of the components of the Affordable Care Act were upheld by the Supreme Court, except one, and that was the mandate that states must extend Medicaid. The government left that, the court said that was a state issue and had to be resolved by the states. And that's why we're here tonight, is to talk about expanding Medicaid. Any questions? Select facts. That's the warning. These are select because we tried to find as unbiased sources as we could whenever we're talking about facts. As I said, it's very difficult. But the Congressional Budget Office rates this law as reducing the deficit. Most economists say that it should have little impact on the job market. That's not what we hear, though, is it? And to tell you the truth, I don't know what the truth is. We're going to have to wait and see what pans out. I don't know if the stories that we're hearing are representative or isolated cases. But I do know that UPS, when they just announced recently, I can't remember when, that they were going to cut spousal care, that was sort of touted as being caused by the Affordable Care Act. Well, in reality, many companies have been cutting spousal care for a number of years. And this was a cost-cutting move that they had planned, according to some people, long before this law came up. So it's not really directly attributable.
Jack, I just saw a video this morning from their CFO who was talking about that. And the same thing, that they cut because the spouses were already getting insurance. But he did mention that, because the interviewer was asking him what they thought about the Affordable Care Act, and he said, as long as the expenses, the hospital and medical expenses get driven down, they're fine with it. It was just that issue of business is going to pay into it more, and then that other reaction doesn't happen. That's where it's going to be bad for business. So, just one part of the sentence that people leave out, it seems like a lot of times businesses are worried about spending the money on it, but they don't think about the good that may come from it down the road as it gets an impact.
That's why this is so complicated.
Yeah.
When if you dice up most credible statistics on this, they're right. It's just they take into consideration different factors. Sometimes they'll take different years. So sometimes it'll be 10 years, sometimes it'll be 30 years, sometimes it's based on, right now, we don't, one of the reasons why we're on it, and this doesn't get talked about much in the press at all, and it's a challenge that I think we uniquely face as Vincentians. We say there's 600 to 650,000 people in Georgia that are uninsured, that Medicaid expansion will help insure. But in reality, there's a good number of people who are eligible for Medicaid today that don't get it. And at first I thought, then what are we doing this for? Well, then I started to study it a little bit more. And anybody familiar with how you recertify for Medicaid? Do you mind sharing with us?
I just came back from California where I have a grandson that has had a tough life. And I sat in on all the Medicaid things that he went through to get, he got something. He didn't get everything. They were very selective.
About how long did the process take?
Long time. It depends. Again, it's,
You're a
this
single
might
mother.
take a long time, this takes a short time. It's just, it's really a process.
You're a single mother. You've got 2 kids. You've got a job. It doesn't pay a lot.
Yeah.
But you're working. Your kids are relatively healthy. They don't have any life-threatening diseases. Once a quarter, you have to recertify. And some number of those times, I don't know exactly, someone told me once every year, you have to do it in person.
I think it's 6 months.
I think it's 6 months.
Is it 6 months?
6 months in Georgia. Or in
Cobb County.
Every state.
So you think this mother, maybe she'll roll the dice. I can't leave my job, I don't have enough hours to take time off. So I won't recertify, and I'll lose my benefits, but my kids are healthy. And then something happens.
But you're also, you just said a little while ago that you can buy child insurance for $50 a year in this state. Not willing to put out the $50?
No, I said that healthy people, kids that are on their parents' insurance, and then they rotate off. I don't know what it costs for that mother to buy insurance for her kids.
Well, I thought you,
No.
isn't there some child thing in Georgia?
Peach care.
Peach care.
Peach
We have
care.
peach
We'll get to-
Yeah.
You have
But
to
that's
recertify.
Medicaid.
That's Medicaid.
That's Medicaid for kids, and you have to
Is that like,
recertify.
oh,
You-
that's not the $50 a year?
No, no. That's $50 for private insurance. And just as a sort of a basic primer, Medicaid is a government program. It does use income to qualify you. The guidelines are the federal poverty level, and each state determines who gets covered. So there's lots of differences, as you were just saying in California, lots of differences between states.
Can I tell you one other thing?
Sure.
When I was there with this boy, he had gotten turned down for probably 90%. He'd get it and then they take it back again. It depends on your person you're seeing. When I was there, their whole attitude changed because they saw a normal person. And so they gave him
Stable
everything.
person.
Yes.
Well,
That's screwy. I mean, I'm his grandmother and I didn't live with him.
It's the interview.
right now in Georgia, there's about 1.7, that should be million people covered, not million, covered by Medicaid. If you don't have kids, you don't get covered. And there's the percentages of the federal poverty level that you are covered, or that you have to meet. If you are making less than $29,000, you would qualify for, I'm sorry, if you're, for a family of 3, if you're making $9,760, you would qualify for Medicaid in Georgia. And as we just said, Peach Care is what we call Medicaid for kids.
So does that mean you can make up to approximately $10,000
still qualify?
Yes.
That's a year.
It's a year for a family of 3.
That's a year.
So it changes by the size of your family. And as you can see here, this is the same chart, but a little more graphic. Kids under 19 get covered pretty well. Pregnant women get covered pretty well. Women that have had breast or cervical cancer, nursing home, community care. Working parents don't do so hot. Now, their kids can get it, but the parents don't. How many have ever been on a home visit where they say the kids have peach care, but I don't? And so what do? Well, I hope I don't have to go to Grady. That's not much hope. This is the largest group that we think will be covered by the Medicaid expansion, childless adults. Those are people that serve us food, make our beds at hospitals and hotels. They're the service workers that we see every day. I can tell you, my most persistent client that I've had, I've been dealing with him for 2 years, is a kid that really needs some mental health help. He can't hold a job as a waiter, and he keeps coming back to us. And he needs to have something better than just what we've been giving him. Expansion would then go up to 138% of the federal poverty level and is expected to cover 600,000 Georgians. We've talked about the Supreme Court ruling. Georgia's governor, the way it usually works is in each state, the governor decides if he or she wants to expand Medicaid. And then they go to the legislature and try to sell it. The Voice of the Poor Committee was brought in by, was asked a couple of months ago by network.org, Nuns on a Bus, to help in Medicaid expansion. And that's how I got involved in it. And the strategy then was to try to find some recalcitrant some governors that didn't want to expand Medicaid. That would have taken all night. And particularly those that had respect in the Republican Party, and use them to try to concentrate on them with as many facts as we could, to then cause other Republican governors or governors that didn't want to expand to be convinced that it was okay. It worked okay. The very first governor, the first Republican governor who said she wasn't going to accept it and then did, was Governor Brewer in Arizona, who said, who expanded. Her legislature fought very hard against it. But we were part of a coalition that included the Bishop of Tucson, who went with us with our Voice of the Poor folks to the governor's office to say, this is hurting poor people, and we have to do something about that. My favorite quote just came out of Ohio. There's a conservative Republican governor there who just endorsed Medicaid expansion. I don't think it's passed the legislature yet. But he said, I believe in small government. I believe in limited government. But I believe when you get to the pearly gates, St. Peter's not going to ask, what did you do to reduce the size of government? It's going to ask, what did you do to help poor people? I'm getting a t-shirt. Yes?
I'm trying to relate your last chart to this. Is that 600,000 extra people, are they childless adults?
Childless adults, and then the working parents here that have kids. It's this group.
Because on this chart, I think you said where the red areas, you were saying what's coming up is really gonna help that particular one
Right.
right there.
Right, this is the one without health care at all today. And here at least you can meet the federal, you get some consideration. But no, there's that. That's a good question, thanks.
How many states, I never knew Georgia didn't give it to childhood couples. How many states also do that?
Well, that's a good question, I don't know.
There's a lot of.
That shocks
Are there?
me.
Jersey definitely was
The formula for funding is that 65% of the cost is paid by the federal government. For the first 3 years, the federal government will pay 100% of the cost of expanding Medicaid. The first year was this year, so we've already lost 1 year of 100% coverage. If the governor were to expand Medicaid and we could get it passed by January of 2014, which we can't do, we would get this 100% done next year. We can't get it done that fast. It won't, even if the governor were to come out tomorrow. The legislature doesn't meet till mid-January. So we've lost those first two. And then through 2020, the plan calls for the federal government to pay 90% of the state's expansion of Medicaid. So it still can be a pretty good deal. There's those that have worried about, well, what if Congress changes their mind? Well, that's always possible, but we don't know. Yes, sir.
Since I just can understand this, in Georgia, if there's a service worker, like you mentioned, that's the group that's going to see the benefit of this. But that's not true in Georgia?
It is true in Georgia.
That they are going to get the benefit?
Oh, I'm sorry. Under the plan, if we were to expand Medicaid, they would have.
But right now?
Right now, they will not.
They don't?
They will not.
Okay.
They will not. And we'll talk a little bit more about that. This is where the facts start to get fuzzy because it's estimates. There's a lot of money for mental health training, mental health work in the Affordable Care Act, mental health treatment, particularly of incarcerated people. And the thought is that that will have an impact, a positive impact on the budget. If we can get more folks out of and avoiding prison, out of prison and avoiding prison by proper mental health treatment, that should save money. There's lots of different theories about what will cost what. But this is the one that is the scariest right now, decrease in uncompensated care in hospitals.
It's going to be shifted.
It's going to be shifted. It's DSH, dish payments, I forget what, disproportionate share of health care.
Uncompensated.
Yeah, and Medicaid now gives Grady a lot of money that comes from a lot of the community hospitals, a lot of other hospitals. They sort of contribute to a pool, and then some of it comes from from Medicaid. The Medicaid portion of that is going to go away. That's how the Affordable Care Act is being paid for. Whether we extend Medicaid or not, the uncompensated health care that Grady does, the Medicaid portion of that is reimbursed, is going to be cut off. So Grady has come out and said, we're in favor of expanding Medicaid.
Yeah.
But the rest of the hospitals in the state have been quiet. And we don't know why. Because rural hospitals are going to suffer from it more. Here, where I live, if somebody without health insurance, and by the way, you have to be legal, but somebody without health insurance goes to Northside Hospital and they're not in a life-threatening situation, they get stabilized and sent to Grady.
Mm-hmm.
So Northside gets reimbursed for a little bit of the care, but Grady gets most of it. That's going to go away. I don't know what's going to happen with it. Owen?
What's going to happen to the people then that, if Grady's not getting any money, are they going to reject these people that, are they allowed to do that legally if they're not?
They are not allowed to do that legally. How are they going to pay for it?
It seems almost a conflict.
The hospital can't turn away a patient. Northside even can't turn away a patient. That's why they have to stabilize them first. Your guess is as good as mine how they're going to pay for it, but I can only believe that we're going to have to pay more taxes. I mean, I don't know how they're going to get reimbursed unless they just do it to be good guys.
Some hospitals are getting a conglomerate that they're forming insurance, like Piedmont and WellStar. They're not only going to provide care, but they're also going to sell health insurance. And so it's just going to be a different type of business. They're not going to get it, but it's, they're very creative.
That's interesting.
Yes.
That's interesting. Father?
What about the Catholic hospitals? How they're going to deal with this? I mean, you said that, some of this Medicaid money might be wiped away. Now, when you come to like religious Christians or Catholic hospitals, which have the core values of, one of the core values is justice, are they going to turn patient away or?
They can't.
No, no hospital can turn a patient away.
Whether they're religious or not.
Yeah, no hospital, it's against the law for them to turn an uninsured person away or any person away. But I can tell you that the reason that Network got involved in this issue was because the Catholic hospitals asked them to. And that's why they've gotten engaged. I was just telling somebody my first grandchild was born in July. Congratulations. I don't know why I get congratulated or even say it's my grandchild. I had nothing to do with it, except a long time ago. And as a surprise to me, my daughter didn't tell me until we got to the hospital that she was giving birth in St. Vincent's in Birmingham, which is a Vincentian hospital. I didn't even know there was a Vincentian hospital. And the first thing I said was, "Thank you so much. That was just wonderful. They've got good obstetricians, right? You're not just doing this because it's a good brand name." But so after the child was born, I went down to the chapel to say thanks, and there was a graduation ceremony that Daughter of Charity was doing for nursing students, and they were all from low-income families. And this is the value that the hospital has. When I went to the nun afterwards and said, "Okay, this is wonderful, that's terrific, and by the way, great hospital, healthy grandbaby, what are you guys doing about Medicaid expansion?" And she said, "We're waiting and seeing." Well, why wouldn't you come out in favor? Because of the politics. Alabama has not expanded Medicaid, and the governor has said he's not going to be in favor of it. So even Catholic hospitals are playing politics on this, trying to figure out what they should be doing. I'll tell you that we, the Voice of the Poor Committee, is part of a group in Georgia called we are attending meetings of the Cover Georgia Coalition. We are not a member of the coalition because there are organizations in the coalition that we would not agree with. But we do go to the meetings to hear what's happening. And right now, the current thinking in Georgia about Medicaid expansion is that we should wait until the governor has said some things about not expanding Medicaid, but has, in some places, he's sort of left the door open that maybe after his primary, he'd be more willing to talk. Now, meanwhile, and we'll talk about it in a minute, some states are coming up with alternatives to Medicaid expansion that their Republican governors are finding satisfying. And well, I don't care if it's Obamacare or Arkansas care, call it whatever you want to, just as long as poor people get coverage. So that's a glimmer of hope.
Do you think that if the government comes in, since we're talking Catholic hospitals, do you think if the government forces our Catholic hospitals to do abortion, do you think we're going to go with what the American cardinals and the bishops have been saying, that we'll close our hospitals?
I would think so.
Good.
I don't see how you'd have an alternative.
Yeah. I don't either.
I don't think it will happen.
What, they will close them, or they'll force us to do abortions?
That's a different question, but I can't think of another.
Yeah.
There's no way. There's no loopholes to that.
Yeah.
Do they have a modification on that issue of, I mean, it was all centered around just religious liberty, something like that. I think that there is some modification.
I think they're working on it, but I don't think they've settled it.
Yeah, I think it's still up in the air. I know that I just read that Cardinal Dolan and the group are looking at the latest proposal, and they're still going back and forth. So that hasn't been settled. But, well, we'll get to that in a second. I want to lay your concerns over adding to the debt. You know, that comes up sometimes. This surprises people when you look at what's the percentage of our national budget that goes towards safety net issues. It's only, as you can see down there in the lower right, 12%. That, now, keep in mind, that's a big caveat. That's without these entitlement programs. So these are big, but these are small in comparison. Still a lot of money. And this is where it goes. And I know that people get concerned about the federal budget. It's not the safety net programs that are hurting us. In fact, I know that's a lot to try to digest. There's also been a lot of talk about things like food stamp swelling over the last, since 2008. Well, as a percentage of our GDP, it is looking like by the end of this decade, will be to almost embarrassing levels about how much we spend on safety net issues. It's not safety net stuff that's causing the budget to be out of control. So we'll just finish up with these benefits of expansion. This is where I think we have to help people as Vincentians. That number that we talk about with that are eligible for Medicaid but are not insured. Every time we go into somebody's home, there's an education that takes place. If your home visits are like mine, it's usually you that are educated. It's one of the reasons why I love this work. But frequently we have to help people see the vision that they may not have had anyplace else. I didn't go to college because I had a choice. My parents didn't come to me and say, do you want to go to college? They said, you're going to college. Where do you want to go? That was the way my future was laid out for me. I don't think that happens in folks, particularly if they're in generational poverty. If you're worried about how you keep the lights on and how you keep the food going, you're not thinking about long-term issues that we think about in the middle class. We talked about predatory lending. You and I get most of our services done for free, rising costs, nitpicky things, but we don't have to pay for a check to be cashed. We can take that in and get it cashed. People that don't have a relationship with a bank think that's just normal course of doing business. You know, I don't know when I've ever taken a cab to a grocery store to shop, but people that I see on home visits do. That's just different than the way I was raised. When you talk about insurance, insurance is a sort of a middle class construct, isn't it? It's not something that if you grew up poor, you don't think about life insurance or health insurance. You know the places where you can go to get those things when you need them. Well, we have to help in some transition. I think we're going to have to help in some education. So I would ask that on your home visits, you start to talk to people about where do you get your health care now. I can tell you what I've started to do, because I'm hoping that someday soon we will get a chance to testify in front of the governor and in front of the General Assembly. When people tell me they don't have health insurance because they don't qualify, and they go down to the Grady and hope that they don't have to, I say, if we ever got to the point, would you be willing to testify? And the last time I did it, the woman said, yes, and I've got 5 friends that are in the same boat, and we're all going. Because I'm not sure that that legislators hear that. They don't hear that perspective. This is a number that surprises people. There is a real economic impact on expanding Medicaid. There's jobs that are created, and there's lots of them. That comes from a Georgia State study. If Medicaid is not expanded, there's going to be an insurance gap. That's those people that, well, let me show you another picture. People that are way below the federal poverty line are probably going to be okay. The people that qualify for the market at the exchanges, if the website ever works, will be able to get private insurance. But it's that gap in the middle. And a study came out by the Kaiser Foundation that said that could be up to 400,000 people in Georgia. That's a lot. Sometimes this issue gets confused with what we were talking about a minute ago about the HHS mandate. The U.S. bishops support Medicaid. They always have. Please don't let people tell you, well, we shouldn't go for Medicaid expansion because we're supposed to be against the Affordable Care Act. The U.S. bishops had a statement in 2009, it was reissued at the beginning of this year, that Medicaid is a good thing. So what can you do? Well, you've already started. You're learning more about it. As I mentioned, I suggest you start collecting stories on your home visit. When the time comes, we're going to probably ask you to reach out to your elected officials and try to influence them. And then, if you want to really get down into the weeds, start looking at some of the alternative plans. The Arkansas plan is the place to start. That's the one that was not Medicaid expansion. It was a different way of getting health care to low-income people. But it's something that we think Governor Deal may be interested in when and if the time comes. And pray. Continue to pray for the people that don't have health care today and may not have health care in the future. Any questions?
Yeah, Jack, I guess the one thing that is a concern that you hear from, like you say, from different perspectives, you never know what's the truth, but that we're going to go bankrupt on these plans. And of course, the current situation seems to me we're going to go bankrupt anyway if we continue to do what we're doing. Because they say, if this is accurate, that we spend more money than any place in the world, but we're like 28th or 29th as far as total health of our country, and that's below China. You picked up something with the children I didn't hear before. So it seems we're going that way anyway. I think we're at 5% back in 1950 that I can recall. That was insurance costs. Now it's 17%. And they say it'll be about 34 or 40% in the next 40 or 50 years. So it seems to me we're going bankrupt that way. What about this way? They're saying we're going to go bankrupt with this too. What's the truth?
We almost went bankrupt 2 weeks ago. And that was as close to bankruptcy as I think will come in our lives. I'm pretty optimistic, and I believe firmly in democracy. But for democracy to work, we have to vote properly. And I don't mean vote for the people that I want you to vote for. I mean we have to think about who we're voting for and hold them accountable when we vote. If we keep doing that, I don't have any worries about bankruptcy. Specifically about this, it's debated how much this will add to our budget. But according to the Congressional Budget Office, which is a source, and you can choose to not believe it, this program will reduce deficits over a 10-year period because of the costs of indigent care that we have today. Now, the key to that is going to be getting people covered. Not only covered, but getting them the coverage that they're eligible for.
Yeah, and then there's, what about the immigration issue now, but is that going to be a factor with?
Immigrants are not covered under the Affordable Care Act. People without documentation. You have to be a legal citizen to be covered under the Affordable Care Act.
And, you know, after all is said and done, don't we have Massachusetts as an example? I mean, isn't that something we could look at and say, okay, what's the truth of this thing? How's it working?
I think it's as good an example as we have for a couple of reasons. Number one is it's the longest experiment we have. And the second, it was really a bipartisan effort, started under a Republican governor, but it had to get Democratic support. And so it's truly something that was crafted by people with both interests politically. And they seem to have the people as their goal, serving people as their goal. So yeah, I think you can look at Massachusetts and see how it's working. Yes, sir.
On the news report, I've been hearing that on this, well, I'm a senior citizen. I got Medicare, so it doesn't really matter. The report is that more people are signing up for Medicaid rather than Obamacare. And tonight I was listening to a news program, and one state signed up 81,000 under Medicaid and 5,000 under Obamacare. And another state had 31,000 under Medicaid and 3,000 under Obamacare. Have the rules changed so much now with this expansion? Has the rules changed so much that they are now eligible? So my question is, if this had been going all along, maybe the voice of the poor should have been telling people, poor people, they should get under Medicaid.
I think there's two questions there.
Probably maybe more.
I'll start with the last one. Yes, the voice of the poor people, Vince Sessions should have been saying, get signed up for Medicaid. Vince Sessions also should be saying, get signed up for food stamps. About 60% of the people in Georgia that are eligible for food stamps get it. We should be telling people, did you check it out? Are you eligible? There's good reasons why people don't. Some of them are pride. Can't criticize that, but don't make sure that your kids eat. So the second question is, yes, we should have been telling. If your state is expanding Medicaid, you're already eligible for it, and it's just then based on income. Wherever you are, you either sign up for Medicaid or you sign up for health exchanges.
So these people that are signing up for Medicaid on the Obama website, are they the people you were talking about, the people that serve you in the hotels and restaurants?
Remember, each state had its own threshold, income thresholds. So I can't say, I really don't know.
I'm just wondering where that, I mean, all of a sudden people realized, hey, Medicaid is going to be a lot cheaper for me than anything else.
Of course, I mean, Medicaid is not insurance, though. I mean, Medicaid is used to get the affordable health care coverage. I'm kind of confused on how he's separating.
That people are signing up for one and not so much for the other.
But the health care has to come from the health care side. It doesn't come from the Medicaid side. Medicaid is only the property level and all these other benefits that you get from Medicaid.
Well, it's the reimbursement. Right. The reimbursement of the doctor. So if I'm earning $10,000 and I've got 4 kids, we go to the hospital, the doctor, they see that I'm on Medicaid, they bill Medicaid for the cover, for the treatment.
Yeah, there's a split on Medicaid. It isn't always everything.
Right.
It's very carefully defined by each state.
What they're paying for.
And it's,
Did you have a question?
it's not all, it's not the answer for everything, trust me.
I'm kind of thinking back when all this was first, initiated with a plan, and I think it was like Iowa or one of the states said, well, we'll vote for it, but we're never gonna pay for it. We want everybody else to pay for our, healthcare and that type of stuff, because the federal funding for it, like you said, over a couple of years is gonna go down, and the states have to compensate for the funding. So that's where some of the states, from my understanding, maybe Georgia is going to be like, well, maybe we need to come up with something that we can afford already in regards to these different healthcare, community centers and that type of stuff. So I'd be curious in regards to what the alternatives are, like the other plans are that, that the states are, because in, Cobb County, we have the community health clinic, we have the, Kennestone, clinic. I mean, there are health providers for our poor that they have to access in regards to what is already existing. I mean, people in regards to Medicare, patients come in, because I work in the hospital, so I kind of have an understanding. And you go in the hospital for pneumonia, Medicare only pays for the 3 days, but you might be there for 7. But that's all that they pay for. They say pneumonia should be treated in 3 days. That's all. This is the amount of funding you're getting. You can be there in a 7. The hospital doesn't get paid the whole amount that you're there. It's just how the billing works in regards to that. So I'm curious in regards to the fear of the state saying, well, the government's going to give us all this money so we can cover it for this, but then what happens? Where's the fallout when the government says, no, we're not going to be able to give you money, and the state still has all these uninsured, and they're like, okay, well, now what do we do?
It's a good question. The first 3 years, we're in the end of the first year, 100% is covered. Till 2020, 90% is covered, and then after that, it's 60%. So that's the gap that Governor Deal is saying we don't know how to. If we expand Medicaid to all these more people, that 60% obviously becomes larger. And what I think we have to do, what economists in the state that support Medicaid expansion are looking for, is there's really no good number for how much is indigent care cost us today. And so they're trying to figure out how much does it cost and does it offset that expansion of Medicaid. If we were, but then you overlay human behavior on top of that, and you say, oh, I don't know. It becomes a theory, and nobody's going to know until it actually happens.
Part of the problem is that we have to shift the way that we do healthcare in this country. We are very much for the cure, and part of the Affordable Care Act is that it's very heavy on prevention, and until we do that, it's going to be a gap. But we put all the guns on pills, on curing, and not in prevention. And until we shift that, it's not going to happen.
And we're not that.
Who's our model for that? Is the UK the model, or Germany, or who?
For what?
Prevention. Who's
Oh,
the
Europe,
best?
the whole country. We are the country that spends the most on health care, and we have the poorest outcomes.
Yeah, but whose plan? What country's plan do we need to go to?
France or whatever.
I mean,
they are all prevention. They try to do prevent.
So we'd be better off with using France's.
Whatever, they have better.
Before we get too much into it,
but it's a different shift.
Each of their
These are
countries
theoretical.
are the size of one of our states. There's no way. I lived for 3 years over in Italy recently, caring for a dying sister-in-law with cancer in a country that is socialized medicine. I got to tell you folks, she got wonderful care and didn't pay a penny. The ambulance came and got her for her treatment. She had all her treatments taken care of. She had food brought in. She had everything.
If I could, before we get into a discussion on socialized medicine,
Yeah.
let's remember we're just talking about Medicaid expansion.
Yeah, well, but
Just
what
a
I'm
portion
saying
of
is you can't
healthcare.
compare those countries to us. We're a whole different animal.
Yes.
I've got kind of a radical idea. Question first on there are large corporations that are self-insured. You know that. I mean, they pay their own for the employees. They let insurance companies handle the paperwork, but in reality, the companies actually foot the bill. And as I understand, under the Affordable Care Act, there's a penalty for those companies not providing medical. But the problem is that penalty is less than the overall cost of their medical. So what's to stop corporations from saying, you know what, we're getting out of the medical business and you'll just have to go into the exchanges? Did they think that might happen? I understand why it hadn't happened yet because there's PR issues surrounding it. But it would seem that once the first company does it, looking for a revenue stream, others will follow suit.
I'm interested in that myself because, you know, there is nothing that says, up until now, there wasn't anything that says companies have to offer health care.
My company spends $5.5 billion a year on health care for their employees, but the penalty under the law will be $795 million.
Up until now, it was all left up to companies. It's a recruiting tool. That's why companies got into benefits in the first place, was, okay, well, we're IBM and you're Xerox, I want you to come work for us, so we'll pay for your health care. And once they took that on, they had trouble getting out of it. Now, to say that they won't get out of it, I think is naive. You look at the whole idea of 401ks, that was a that was changing company pension plans to government-run or government-approved insurance or investment policies. Companies were able to get out of something that they thought was a really big sword of Damocles and sort of allowed it, pushed it back to the individuals. It was a creative response, I think, to some problem that they were going to have. I don't know what's going to happen.
Yeah, I think you're right, because like companies have done that already with Medicare. All those retirees would be on a company plan years ago, now we're in Medicare. But I got to think that what they would do is raise that amount, the penalty. That's what they wanted to do.
I can tell you that as long as I was in human resources, I had always identified, not because I was brilliant, just because I saw what everybody else saw, I always identified healthcare as the biggest challenge that we would have as a company, as a country. When we would change our plans and people would come into me and say, well, should I retire? I can't speak for you, but which plan are you going to be covered better by and when you're retired? Because this lump payment that we're giving you now is going to go away. But 10 years from now, you're going to want to know that your health care is as good as it can be. So if you get better health care insurance, I'd look hard at it. Because that's the thing that's going to...
Yeah, and I think a lot of these companies have been thinking the change all along, and this is giving them the impetus to, well, this is the time to do it. It's Obamacare or whatever else they're going to say. Then you have the Cadillac plans where they're not going to pay the taxes, so that your plans are going to change because companies are not going to pay that tax.
It's hard to say. Yes,
I got one more question. Has anyone looked into, and I don't see either party talking about this, but the same market forces that keep a McDonald's hamburger at 99 cents rather than $7, could that not be applied to medical? Because medical, in some forms, is really a commodity that someone is selling. I mean, there are no market forces. We've all heard the horror stories of an aspirin being $10, a cotton ball being, you know, there's no market forces to control cost. And it would seem to me you're still going to have the problem with the poor. Obviously, we've got to do something about that. But market-driven forces would bring the price of medicine down for everybody.
There's insulation around that that's not true in the free market. How many people comb through their explanation of benefits every time they go to the doctor?
Exactly. Nobody checks because...
The thing is with health.
Okay, two.
Nobody checks. Nobody checks because there's...
So the market forces that would keep competition where it needs to be aren't there. Newt Gingrich,
totally agree.
10 years ago, put a website together in Florida that compared death rates of hospitals. That's consumer information. I'd want to know if I'm going to this hospital, do more people die in this hospital over here? They had it shut down.
But nobody checks because they're conditioned under a certain circumstance. There haven't been market forces in medicine in a long time. And so that, as that has happened, costs have gone up. But it would seem, for the same reason that you go to Jiffy Lube and you pay out of pocket for your oil change, you don't claim it on your auto insurance. If you did, it would be $700.
Since I'm at the front of the room, I get the last word. I truly do think, and I've tried to figure it out, the rising cost of health care is so enormous because we do have the best technology in the world. While we spend more than any other country, or than many countries, not any, spend more than many countries and don't have great outcomes, we still have outstanding technology, and it causes us to live longer. And when we live longer, we consume more health costs. And so to me, that's got to be the biggest contributor, is that it's working. So I know I've kept you here a long time.
No, and you have a long way to go home, so I think about you. But
Thank you.
Maria and I went, 3, 4, 5 months ago and heard Jack and a couple other folks speak, and we learned so much, and I've learned more again today. Like you said, it's complicated, but many of us here are caseworkers, and I think most of us are hearing it probably once a month, twice a month. Our very people are suffering from exactly what you're saying. So, Jack, we so appreciate you coming here.
Thank you. Thanks for the invitation. Good to see you all. Sign up for CapWiz to get the alerts from Voice of the Poor. We're about to send one out on food stamps this week.
Yeah, and I think we get that.
Yeah, you can get another copy, we'll give it to all. That's all, yeah, that's a good way. That's a good,